for the general public, there is now the advice that they can use or should be encouraged the use of non-medical mask. The non-medical mask is often called face coverings or cloth mask, and here we're using the terminology from now onwards as fabric mask. So these are basically things that either can be made at home, they can be commercially purchased. We actually have some here we can show. The idea is that these actually, the reason we're doing this is because many times in the community now there are concerns about not only not maintaining the distance, but there is discussions now around how much transmission is happening through either pre-symptomatic or asymptomatic transmission. So taking that into consideration, and as Benedetta was saying before, this was then taken back also to the guideline development group and looked at. And now really the consensus coming out is that when people are in the public with these masks, they can actually use, and they provide some source of actually control. So what they do is they prevent person who may actually have the disease from transmitting it to somebody else.
So if I might just add to that, yes, so we do have this new advice to encourage decision makers to make the recommendation to wear a face covering and a fabric mask. And what is really new in the guidance that is being published is the research that we requested to be done on this innovation and engineering and looking at actually which types of materials can be used in making these non-medical or fabric masks. So what we have in the guidance are details around which types of materials, the numbers of the layers, and we recommend 3 layers of to build this fabric. The inner layer being an absorbent material like cotton, a middle layer of non-woven materials such as polypropylene, which is the filter, and an outer layer which is of a non-absorbent material such as a polyester or a polyester blend. And in doing so, what the evidence we have through this research is that with those 3 layers and in that combination, that fabric can actually provide a mechanistic barrier that if someone were infected with COVID-19, it could prevent those droplets from going through and infecting someone else. And this is new, novel research that WHO commissioned that we didn't have a month ago. And this started when we convened the world's experts on a variety of topics in February to discuss what are the key questions, what are the critical questions that must be answered in areas all the way from epidemiology to infection prevention and control, health workers, all the way through clinical trials for vaccines and therapeutics. And this is new, and this should be encouraged even more. We need our partners to carry out studies to be able to help us make the best guidance going forward. So if people are going to wear a medical mask, a non-medical mask, or a fabric mask, it can be done using materials that can actually provide that barrier. And in our guidance that we're releasing now, it gives the outlines to do so. And we're talking not about giving advice to companies to build them. You can do this at home. These are materials that can be sourced by individuals and put together in a certain way so that it can provide that barrier. So that is something that is new. This area of research will expand, it will grow, and we will evolve our guidance as more information becomes available. We also encourage leaders in countries that have the capacity to do so, to carry out studies to show how do these masks work, what kind of benefit do they provide, because we need this. We need to fill this space. It's an open question, and we need the research.
With the fever, with the cough, and our sneezing, you should not be in public. You should be seeking the care of a medical professional and seeking a COVID-19 test. And if that test is positive, you need to be cared for appropriately in isolation, and all of your contacts need to be traced and followed for 14 days. And this is where the Director General has said in his speech, that masks are part of a comprehensive solution. And we to be very, very, very careful that masks are not seen as an alternative to the other public health measures that are so desperately needed. And you'll see in the countries that have done well, and many people have said to me, well, masks are used broadly in country X or country Y, and country X and country Y are doing well. That's great. But in those countries, case finding, cluster investigation, widespread testing, isolation of cases, and quarantining of contacts is also done comprehensively. So where we see success in countries, and I think I said it at the next, a health system that's capable of treating people successfully, and all of that in the context of good coordination, good governance. When that is being implemented, then the appropriate and targeted use of masks at community level in order to reduce transmission within the community in areas where physical distance cannot be maintained. And I think we've been consistent in this, and I think the work over the last number of weeks, and we'd like to thank our academic and science partners for this, was to come up with what is the best form of face covering, how can we make those face coverings most effective in achieving that objective. Thank you.
Thank you very much. Now we will go to the United Arab Emirates News Agency. We have with us Ahmed Haroun. Ahmed? Can you just press unmute, please, Ahmed?
Do you hear me now?
Yes, now it's okay.
Yeah, very good. Thank you very much, Tarek. I'd like to ask actually about the impact of the chloroquine and hydroxychloroquine on the people having the familial Mediterranean fever.
Ahmed, can you just repeat? We didn't really get what sort of fever you were referring to?
The familial Mediterranean fever.
Okay, let's see if anyone can comment.
What is the question?
This is a genetic disorder, and I think it should be the treating doctor. It needs an expert physician to actually guide the patient. So this is probably not something that we could discuss just now. Thanks.
Now we have Ajit from United News of India. Ajit, can you hear us?
Yes, can you hear me?
Yes, it's okay.
Okay. Thanks, Tariq. My question is related to India. In last few days, cases have been increasing rapidly in India. So is there, seeing the population density of India, is there any specific concern in WHO regarding the situation here? Thank you.
I'll begin while Sumi is doing musical chairs here. The number of cases in India has been going up by an average of 33, a third per week. So it's probably doubling time of the epidemic in India is about 3 weeks at this stage. So the direction of travel of the epidemic is not exponential, but it is still growing. And as such, and there's also very different impacts in different parts of India, very different between urban and rural settings. In any setting, and we've seen this in South America, in Central and South America, over the last couple of weeks. And I would say that in Africa, particularly in South Asia, not just in India, but in Bangladesh and other countries, in Pakistan, other countries in South Asia, with large, dense populations, the disease has not exploded, but there is always the risk of that happening. And as the disease generates and creates a foothold and gets a foothold in communities, it can accelerate at any time. And as I said, we've seen that in a number of settings. The measures taken in India certainly had an impact in dampening transmission. And as India, as in other large countries, open up, and as people begin to move again, there's always a risk of the disease bouncing back up. There are specific issues in India regarding the large amounts of migration, the dense populations in the peri-urban environment, and the fact that many workers have no choice but to go to work every day, and there's a lot of threat to livelihood from not being able to do so. But I'll pass the floor to Sumia, who's got a much closer perspective on the situation in India than I would.
I think, Mike, you covered the major points. Of course, India with a population of over 1.3 billion, the numbers that we see now, which are over 200,000, they look big, but for a country of this size, it's still modest. I think the important thing is to really keep track of the growth rate, the doubling time of the virus, and make sure that that doesn't get worse. And also, because it's such a heterogeneous and huge country with very densely populated cities to rural areas where the density is much lower, and also with the health systems being different in different states, with all of these offer challenges to the control of COVID. I think what's been happening with the expansion of testing, tracking, making sure that contact tracing is done, making sure that clusters are identified and dealt with, particularly in the overpopulated, very dense urban settlements in the low-income groups, making sure that mass gatherings do not happen, because these are really the situations where the spread can happen and you can get these high transmission events. And also, as the lockdown is lifted and as the restrictions are lifted, to ensure that in all aspects of life that there is precautions are taken, that people understand. And I think we have been making this point repeatedly, that really, if you want behavior change at a large level, people need to understand the rationale for asking them to do certain things. We're talking about the wearing of masks. I think in many urban areas in India, it's impossible to maintain physical distancing. And therefore, it would be really very important that people wear appropriate face coverings when they're out and about. Also in office settings where physical distancing cannot be maintained, in public transport, in educational institutions, as some states are thinking about opening. I think every institution, organization, industry, and sector needs to think about what are the measures that need to be put in place before you can allow a functioning. And it may never be back to normal. We say wherever possible that if people can work from home, there are certain professions where you can work from home, that could be encouraged. But of course, there are many professions where people have to go to work, and you need to put in place measures which allow them to protect themselves. It make it easier for people to both protect themselves and protect others. And I think communication and behavior change is a very large part of this whole exercise. And I don't know if Maria, you want to add more to that?
Yeah. By the way, one thing I would like to add is, of course, COVID, it's very unfortunate, and it's challenging many nations. But we need to look for opportunities too. For instance, for India, this could be an opportunity to speed up Ayushman Bharat, especially with a focus on primary health care. And I know there is a very strong commitment from the government to speed up the implementation of Ayushman Bharat. And with primary health care and community engagement, I think we can really turn the tide. Using and speeding up what has started could actually help in India. And